Okay, thank you everyone. Thank you for joining and welcome to this IAQM webinar, Air Quality Management in the UK, What's the Hold Up? Today we are joined by Anil Namdeo, Professor of Air Quality Management at Northumbria University. Anil is a chartered environmentalist and chartered scientist, as well as being a fellow of the IAQM. In this webinar, Anil will be looking at the factors that are contributing to the failure to meet air quality objectives. It will identify the bottlenecks which can be overcome, the disconnection between local and national policies, and the key players that could be involved to explore and target polluting behaviours and overcoming barriers. As always, there will be the chance for questions at the end of your presentation, so please do submit these in the Q&A option at the bottom of your screen. You can submit these at any point during the presentation, and I will then ask these on your behalf later on. Thank you very much for logging in, and I'll now hand over to Anil. Thank you, Anil.
Thank you, Ethne. Thank you very much for your introduction, and good afternoon, everyone. I'm Anil Namdeo. As Ethne said, I am a professor of air quality management at Northumbria University. So my topic of talk today is kind of provocative. I'm going to raise more questions than probably providing answers, but maybe this is the right time to raise these questions. So I'm going to talk in general about air quality management in the UK, but before that, I will set perspectives related to air quality and health. What are the global and UK perspective? How many people are affected by air quality and in terms of health and so on? How is air quality managed in the UK? What are the legal framework? What are the policies? What are the current set of solutions which have been tried in the country? We still have some accidents. We are going to see the number of accidents, and we will try to find out what could be the holdups there, what could be the barriers which are contributing to us the problem, as well as not finding the right solution or enough solution. And maybe we'll look at some of the way forward we can adopt. So just a global perspective to begin with. Probably you have seen this report which came out about 10 days ago. This gave a very good perspective of international scale of air pollution problem. So this report is called 2020 World Air Quality Report. And it highlighted that there are about more than 7 million deaths per year which are attributed to air quality, poor air quality. And also it contributes to economic impact of $2.9 million per year. And what this report suggested was that most of the cities which are failing to meet the air quality standards are located in developing countries. So the one figure quoted by the report is that 49 out of 50 of these cities are located in China, India, Bangladesh, and Pakistan. And there also have been some studies which have tried to look the levels of air quality, people's long-term exposure to poor air quality, and how it has affected the COVID-19 related deaths and hospital admissions. So one of the findings of this report are that between 7 to 33% of deaths from COVID-19 are attributed to long-term air pollution exposure. So air pollution is a big public health hazard. And globally, it is ranked as number 4 risk factors for death. So that is total air pollution ranking is 4th. But if you move on to, for example, some regions of the world, for example, Southeast Asia, household air pollution, which is indoor air pollution, is number 1 cause of death. And outdoor air pollution is number 6th cause of death. So we can see the gravity of the problems related to air pollution, 4th worldwide, and number 1 in some of the parts of the world. So air pollution has been linked with several health impacts. And if you look at the figures for some of the diseases, you will find that air pollution contributes to from 11% to 41% of some of the diseases. COPD, 41% of the deaths all around the world are attributed to poor air quality. About 35% of lower respiratory infections related deaths are attributed to poor air quality. And out of this set of air pollutants, most of the studies have found that the fine particles which are below 2.5 micron in size, contribute significantly. So about 3 million deaths worldwide are attributed to PM 2.5 alone. And there are other diseases which are linked with air pollution. For example, in the previous slide, we looked at diabetes. And so type 2 diabetes, air pollution is third leading cause for diabetes of type 2 nature. There have been studies which have linked air pollution with neurological disease, also decline in cognitive functions. Childhood obesity is also linked with exposure to poor air quality. And very recently, just a few days ago, Guardian published another article and mentioned a study which linked exposure to air pollution and its impact on fertility. So at the bottom of the screen, you can see the name of a study which has just been funded to us at Northumbria University. We are going to look at the long-term exposure to ambient air pollution on outcomes of assisted reproductive technologies. We're going to look at IVF treatment and others, and so on, whether the exposure to air pollution affects the success of these technologies or not. So I presented the global picture. What is the picture for the UK? So there have been several long-term studies published linking air quality levels and its impact on health. So earliest, most authoritative study was published by COMIEP, Committee on Medical Effect of Air Pollution, in 2008 using 2008 data. And it suggested that about 29,000 deaths worldwide in the UK are attributed to exposure to 2.5. Then more studies published by European Commission, Global Burden of Disease study in 2010, and DEFRA published a report in 2015 combining the data from COMIEP and other studies and suggested that PM 2.5 and NO2 combined could be responsible for 44,000 to 52,000 deaths in the UK. Royal Commission of Physicians, the report published in 2016 using 2013 data, suggested a combined figure of about 40,000 deaths in the UK attributed to PM 2.5 and NO2 mainly. So what have you been doing in the UK? So if you remember Environment Act 1995, it established the review and assessment process. Most of the local authorities in the UK are following several rounds of review and assessment process that falls under local air quality management process. So each local authority is required to submit annual status progress report depending on which region of the country you are. And the reports are labeled differently. And then each local authority has to come up with a set of action plans to find ways to meet the air quality targets, which these local authorities are failing to meet. So if you look at the air quality management framework in general, which has been used in the UK, it generally starts with air quality monitoring. You need to have good idea of what are the levels of air quality in any local authority, different parts of local authority. So first port of call is air quality monitoring. But air quality monitoring is very expensive. So you need to rely on air quality modeling so that you can have spatial and temporal variation in air quality across the local authority. Supplement it with monitoring data, then you have good understanding of the level of air quality. And if you have been doing this for many years, then you build up your historic database of accidents occurrence, where the accidents are occurring, and what are the main activities which could be contributing to incidences of air quality in these areas. So sometimes source apportionment studies can help you in finding major sources. So once local authorities have found the areas which are not meeting the air quality objectives, then those areas are declared as air quality management areas, AQMAs. Then the local authorities will have to come up with action plan. And several types of strategies have been tried by different local authorities, some short term, some medium term, some long term. And I'm going to talk about these strategies which have been used in the country by different local authorities in a different way. Once you have implemented the action plan, the next task is to evaluate it, evaluate its effectiveness, maybe monitor after the implementation model, and see what are the changes, whether the strategy has been effective or not. So if you look at the action plans, which have been followed by different local authorities, you can group them in different categories. For example, tactical measures, localized ones, could be maybe you're using intelligent transport system to manage traffic. You might give priority to buses at junctions so that their journey time is less. Some local authorities had adopted bus-only lanes so that the bus journeys are smooth and also take less time compared to if you're using private vehicles. High occupancy lanes have been tried. Traffic calming measures have been tried in different places. If you talk about strategic measures, then several big cities have tried park and ride schemes so that you could leave your private vehicle outside the city and take the bus to travel to city center or the major centers of employment. In London and other places, low emission zones have been tried. In London now we have ultra low emission zone. There's a lot of discussion has gone on around developing clean air zones. So different classes have been suggested and some local authorities are going ahead with clean air zones. Road user charging could be another way of reducing congestion on the roads and number of vehicles on the road. So in London, it is called congestion charging, but in Singapore and Norway, it's called road user charging. So you can have this way of reducing number of vehicles on the road. Some local authorities have tried speed reduction on urban roads, mainly for safety reasons, but also for air quality reasons as well. On our motorways, we have tried variable speeds and adaptive speeds to limit or control number of vehicles on motorways and reduce congestion. Freight management is very important. Freight deliveries, especially in big city centers and shopping malls, can contribute to localized air pollution. So there have been different ways of managing freight, which have been tried. Integrated public transport system is another way of swiftly moving people from origin to destination. And there's been a lot of uptake of cycling, so we need to provide cycling infrastructure, and some local authorities have improved the cycling infrastructure. Interventions can also be grouped into another category called technological interventions. So for example, if road transport is a major contributor to air pollution, what can we do to reduce emissions from vehicles? So clean vehicles have been developed. There's a lot of development progressed over last 20-25 years from Euro 1 to currently Euro 6 and so on. Retrofitting of vehicles, and there's a lot of talk about electric vehicles, and there is a policy to reduce the sale of diesel and petrol vehicles by 2030 so that only electric and hybrid vehicles are sold. Autonomous vehicles can also be used as one of the ways to reduce congestion and emissions on roads. If you look at strategically, probably land use and planning could be very important way of controlling air quality in cities. You can see the impact of compact cities versus urban sprawl, what Generally, you will see in USA, when you have urban sprawl, people depend more on private vehicles than compact cities where you can invest more money on improving public transport, so more people use public transport rather than using their private vehicles. And third set of measures for air quality management, I term them soft measures. So you provide information to public about the air quality, and send air quality alerts, what is going to happen today, tomorrow, and next couple of days. Awareness programs have been implemented by different local authorities so that it encourages people to shift the mode of travel. Give up probably walking your private vehicles for shorter journeys. Can we walk? Can we cycle? Can we use public transport? And we have all seen the impact of teleworking or working from home during COVID-19 lockdowns and before that as well. So I'm going to have a couple of slides on the impact of COVID-19 lockdowns on the level of traffic and air quality. So we've seen these set of measures categorized in 4 categories, a lot of actions, plenty of actions, but we still have air quality exceedances. If you look at the data from the DEFRA website, which gives you number of air quality management areas declared in the UK, you'll still find more than 600 air quality management areas declared, predominantly for not meeting the standard for NO2, and some for not meeting the standard or objective for PM10 and SO2. And if you look at the sources for which these air quality management areas are declared, you will find that predominantly it is the road transport or the transport in general, which is responsible for declaring more than 500 air quality management areas. So that's why a lot of focus of action plans and recommended policy is on reducing emission from road transport. So if you look at air quality management areas in the UK, and again, DEFRA gives you this map which shows where these air quality management areas are. If you zoom into different regions, you will find that local authorities have adopted different ways of declaring a quality management area. On the left-hand side, if you see here in Liverpool, all of Liverpool has been declared as an air quality management area. Neighboring Greater Manchester, you will have area-wide air quality management area as well as which are focused on roads. Another cases here is London, area-wide declaration of air quality management area. Whereas in Reading, Newcastle and Gateshead, you can see some areas as well as some roads which have been declared as air quality management area. So we have seen this air quality management approach at IAQM being practiced for more than 25 years. We still have the problem. So what we have found that IAQM process is very efficient at identifying the problems. You have seen from previous slides, declaration of air quality management areas, where they are, the geographic extent. We know a lot about the problem areas. So we are very efficient at identifying the problems, but we may not be very good at solving the problem. We need to understand what are the uncertainties when you're declaring air quality management areas, what are the frequencies of exceedances, the duration of exceedances, and when we have come up with action plans, have those action plans been effective in reducing air quality concentrations? Effectiveness action plan, I just mentioned about that. Are we focusing too much on technological solutions? Do we understand the activity profile, sources which are contributing to this? Do we understand the activity pattern, the spatial variation and temporal variation in activity? We have very good legislative framework which works very well from top down. So at national level, we had Environment Act 1995 and several air quality strategies, and then Air Quality Standards Regulations 2010, and more recently, Clean Air Strategy updated 2019. And now we are discussing Environment Bill 2020. So we have very good set of national level of legislation. But at local level, we are generally still relying on local air quality management process. Do we have the feedback from IAQM back into national legislation? Have we learned lessons from how local authorities are managing the problem, what the issues they have? Are these problems localized, general, or not? And the most important aspect is public's perception and acceptability of policies. We might have drawn several policies at national levels and probably some at local level. What do public think about these policies? How do they perceive these policies? Do they accept these policies? How many of these policies are ignored and how many of them are accepted? So we do not have good understanding of public's perception and acceptability of policies. Do we need to talk about local solutions for local problems, or we need to have a set of measures which are suggested at national level and each local authority is trying to implement them? Probably this is the time to think about local solutions for local problems. So I'm going to pose a lot of questions here. Probably during the discussion, we might find some of the solutions. So are we looking at the problems correctly? Are we trying to find a one-size-fits-all solution for the problems, varied nature problem? Are we ignoring key contribution factors and local settings, local sources, variations in activity patterns, spatial and temporal variations in activity pattern? How do people conduct their activities, when and where? Time spent in different microenvironment. Do we understand that? What are the localized effect of topography, local effect of meteorology, as well as long-term effect of the transport of pollution from the neighboring regions and even the continent? Is our policy proactive or reactive? Do we have the right set of regulations? Is our set of regulation integrated? Is it forward-looking or not? We need to discuss these issues. And you will find that most of the solutions so far have been technological solutions. Do we need to go beyond technological solutions? Are we focusing too much on outdoor air quality? We spend more than 90% of our time indoors, and during lockdowns, we spend more than that actually, probably close to 100% of our time indoors. We need to understand how outdoor air quality infiltrates into our house and vice versa. So this continuum of outdoor and indoor air quality has not been fully understood. So we need to spend more time understanding this interaction between outdoor and indoor air quality. So I'm going to put some ways forward, probably may not work, but these are just my thoughts and maybe random thoughts. One of the issue which is probably often ignored, talked about in close circles, but not talked about very widely, is environmental justice. Are all section of the population exposed to same level of pollution? Probably not. So there is inequality in exposure to environmental pollutants, more specifically air pollution. Sometimes some groups, vulnerable groups, it could be children, elderly, pregnant women, and people with pre-existing conditions, they may be exposed to higher level of pollution than healthy people. Maybe socially disadvantaged communities and even BAME communities could be exposed to higher level of pollution. This is a disproportionate impact on certain sections of our community. So we need to understand this aspect as well. Or do we have our priorities right? Too much focus on NO2, probably. We need to shift our focus on particulate matter as well. You have seen from one of the slides I presented that close to 29,000 deaths are attributed to PM 2.5 alone. although we are meeting the air quality standards for PM 2.5, but it is still contributing to 29,000 deaths out of, say, 42 to 52,000 deaths DEFRA have estimated. So are we just talking about NO2? Probably need to cover particulate matter exposure as well. There's a lot of focus on meeting air quality objectives. Local authorities, air quality management process, IAQM is obsessed with meeting the standards. Everybody is talking about NO2 level, 40 micron per meter cube annual average. If it is below that, that's fine. How are we going to say that 39 micron per meter cube annual average is not as bad as 40 or 41 micron per meter cube? In that context, I think we need to shift our focus from standard-based policies to health risk-based policies. Several studies have already demonstrated that there is, for example, there is no threshold for exposure to PM 2.5 or PM in general. Even at lower level of particulate matter, we have adverse effect of it on our health. That's why you have 29,000 deaths in the UK attributed to 2.5, although the standards are met. So we need to focus on health risk-based policies. Our policy should focus on exposure reduction approach rather than just focusing more on meeting the standard. And if you're meeting the standard, doing probably nothing or less. I think we need to have a right conversation. I'm going to present the findings of UWE, which is University of West of England. They have carried out very fascinating research in one of the projects called Clear City. And they suggested that we need to bring citizens, communities, and organizations on board in this process to tackle air pollution and its effect. We need to improve perception of risk. People often do not understand the risk associated with their activities and the risk it poses to air pollution and health. We need to present the findings in such a way that people understand, not abstract or analytical formats. People don't understand 39 micron per meter cube or 40 micron per meter cube. You need to present this information in a format which people can understand. At the same time, we don't want to overwhelm people with evidence. If you have too much information, then probably people become insensitive to that information. So we need to have a right balance of right information and right pitch of that information. Probably we need better contextualization so that people can make sense of the data being presented. And how does it relate to the real world? That is the important thing which is often missed. Can we reduce psychological distance? So people know the actions of one set of things, and air pollution, its impact on health is another set of things. Often people do not connect the link between the activity, their actions, and the consequences those actions will have on air quality and ultimately on health and cost. So we need to reduce the psychological distance, let people understand the consequences of actions on their cost as well as health. A lot of times you get the briefs, policy briefs, either from local authorities or from the central government. It's mostly negative. So higher taxation, asking people to reduce consumption without linking it with the quality of life and how it affects the cost and health. People, I'm conscious of time, so nearly 30 minutes. I'm going to rush through my last set of slides. We need to really understand the role of environmental psychology. Engagement with the public is a new frontier. We need to understand people's behavior. That understanding behavior and needs leading to emission generating activities. We need to understand the behavior which leads to emission generating activities before developing solutions. One example you can talk about is travel behavior. Why do people travel from point A to point B? We need to understand, is there connected activities? For example, school runs, work, shopping, leisure. So we need to have a good map of activities. We need to also consider people seek convenience, cost saving, time saving, and distance saving is also important. More choices are available, but is the alternative reliable? Is it efficient? Is it affordable? What about my last mile connectivity? If I get down at the tube station to go to my workplace, how do I go? Do I have to travel for more than 2 kilometers? Are there bikes available? Are there other alternative modes for the last mile connectivity? There's 3-4 slides more. So during lockdowns, we noticed that there has been significant reduction in travel and air pollution concentrations. So talk about 50 to 60% reduction in amount of travel and also in the level of air pollution concentrations. Big shift in the use of public transport. There's big increase in active travel, walking and cycling. So we have seen people are working from home successfully. Will it continue? Should it be encouraged? What can we do to facilitate it? So I'm going to present some of the findings which are recently reported in Guardian using Department for Transport data. For example, it gives you the car usage right from last year, March to this March. You can see during the first lockdown, 75% reduction in car usage. And during the unlocking period in July, August, and September, it went back nearly to the same level as previous years. Currently, it is about 75% of the levels which we have seen in previous years. What about journeys on buses? There's a big reduction during first lockdown, and now about 40%, close to 50% bus journeys are taking place compared to what it was in year 2019 and years before. When you talk about, for example, London tube travel, it is now back to about 25% of the original levels or the levels before the lockdowns. If you're talking about active mode of travel, walking and cycling, so this figure talks about cycling levels. So during first period of lockdown, cycling activity increased 4 times, 400% increase in the level of cycling, but now it's back. Not back, it's about 100% doubling of cycling activity in the UK. So this is my last slide. So to summarize, I have given you a lot of information, but mainly raised a lot of questions about why we are still seeing exceedances of national air quality objectives, predominantly for NO2 and predominantly caused by transport. We looked at how IAQM process is very good at identifying the problems and hotspots, air quality management areas. But there is a need to understand the uncertainty associated with it, the bottlenecks in delivering the air quality benefits of action plans. We also looked at legislative framing, and maybe there is a need to have not only the top down, but bottom up legislative framing on policy setting. We also looked at how important it is to understand behavior of the citizens, why people do certain activities, the frequency of doing those activities and distribution, the profile of those activity patterns we need to really understand. We've seen that public landscape is changing. Public has changed. Has our policy changed with that? So probably we need to have a rethink about our policy framing and involving citizens for developing action plans. So with that, I think I will conclude my presentation. And happy to take questions.
That's great. Thank you so much, Anil. That was a really great overview of air quality management in the UK and some food for thought about how it can be improved. We've got a lot of questions coming through, so I'm going to kick straight off with some of those from attendees. I'll try and get through as many as I can in the time available. So our first one here is from Peter Fleming. And he was asking, how can we assess the effectiveness of measures in terms of actual pollution concentration reductions, as opposed to predictions from models, which can be optimistic?
Very good question, Peter. I think we need to have a hybrid approach here. So we definitely need to have monitoring because models are there, but unless they are calibrated and evaluated against measured values, we will not have confidence in our modeling outputs. So when you are setting up models, you need the monitored quality data. And once you have the confidence in your modeling output, then you can apply them to test different scenarios, future scenarios.
That makes a lot of sense. Thank you. I'll move on to the next question. They've said that it's a good focus on outdoor air quality and social inequality. Do you think there should be a government health focus and research on impacts to indoor air quality, for example, passive smoking and VOCs, particularly as people are working from home and schooling since lockdown?
Yeah, very good question again. I think, we have been focusing a lot on outdoor air quality because this is where our monitoring stations are located and we are collecting a lot of information from outdoor environment. So a lot of focus was on outdoor air quality, but we have seen that we spend more than 90% of our time indoors, and indoor air quality also needs to be taken into account. There have been some projects which have looked at indoor air quality, but not to that extent where the focus has been on outdoor air quality. And also we need to really understand how the outdoor air quality infiltrates indoor environment. With now new built houses, especially in AQMA's airtight houses, we don't know whether we are benefiting the occupants of those buildings or not. Maybe we are trapping the indoor air pollution and letting it stay indoors for longer durations. So we need to understand that.
Yeah, that's interesting. Great, thank you. Moving on to a slightly different question. One of the attendees has said that you mentioned that the national approach has been quite strong, but points out that the national approach to NO2 has been to devolve responsibility to local authorities. Clean air zones are talked about, but are coming in quite slowly. Do you think there should be greater national responsibility for introducing clean air zones to make sure that they happen?
Yeah, I think a very good point again. And my colleagues at UWE, University of West of England, they have been looking at clean air zones and their effectiveness and how it has been implemented. And there have been some points raised by local authorities. I do not want to name local authorities. Some anecdotes have been that they have been left out to hang, dry in public, and did not have enough support on developing clean air zones and implementing them. They're left to deal with public responses to clean air zones, and then what to do with those responses and how to evaluate the public participation and acceptance of clean air zone has been missing.
Great, okay, thank you. And talking of national legislation, we've got a question asking about the Environment Bill, which is going to require a target be set for PM 2.5. A standard is quite easy to express, but how can we set one that's a health risk target? Do you think this would be much harder to set?
Yeah, I think the way forward is health risk-based approach. It's not easy because people can understand numbers, standard, 40 microgram per meter cube for NO2, annual average, and so on. So that's easy to achieve. But I think you need to have a combined approach. You start with your air quality standard-based approach. Then you focus on to your areas of concern. For example, Manchester you take, then superimpose the population where people are living. Also superimpose the pre-existing conditions, the number of people who are taking inhalers, registered with GP and so on. And then estimate the health risk of the population exposed, not the whole geographic area. It's a long way to go, but I think we have to make a start on health risk-based assessment.
Yeah, I think it is really important and something that's been talked about quite a lot in the sector. Thank you for that. An attendee's asked that, well, as you said, there is particular focus on nitrogen oxides with respect to environmental permitting, but there are no limits for particulate matter. Is there any indication that DEFRA or the Environment Agency may shift its focus to equally tackle particulate matter in the near future by introducing things like PM limits into the environmental permitting regime?
I think for ambient air quality, we do have national air quality objectives or standards for PM10 and 2.5. So they are there, but when we talk about WHO guidance, our standards are not as strict as WHO limit, air quality limit. For example, 10 microgram per meter cube and 20 microgram per meter cube for 2.5 and 10. So standards are there. I think maybe the question is not framed correctly. For ambient air quality, we do have the standards for PM10 and 2.5. Might focus more on the exposure reduction approach. So we are meeting PM10 and 2.5 standards, but still having this negative impact of 29,000 deaths related to particulate matter. So we need to develop our action plans based on that.
Okay, great, thank you. You mentioned bringing citizens on board and a rise in environmental activism. But at the same time, there is a powerful car lobby and actions to reduce motor vehicle traffic are strongly resisted. What methods are successful in demonstrating the positive impacts from actions to deter motor vehicles in order to convince drivers and bring them on board?
I think understanding behavior of citizens is very important, but this process has to be a two-way process. You cannot just have transfer of information from top to bottom, say, you can call it, just passing of the information from via the leaflets and the media and so on. So just giving information is one thing, but you need to have participatory approach, engaging with stakeholders. So that includes communities, NGOs, local authorities, bus operators, and so on. And the buzzword these days is co-creation and co-design. So I'm not a big fan of buzzwords, but I think these two words are very important. We need to create and we need to work with the stakeholders, the people who are affected by poor air quality, for example, in finding the solutions. There's no point in developing a solution in London, which will be enforced in Newcastle.
Yeah, no, yeah, I completely agree with that. Thank you. And hopping back to PM 2.5 quickly, someone's asked, if PM 2.5 is a target, how do we define it better, considering that the value varies so greatly, even between MCERT's approved analyzers?
Very good question. Again, when we started dealing with particulate matter, probably some people may be too young to remember, we started with suspended particulate matter, SPM. Then we moved on to PM10. And then new evidence came out which said PM 2.5 is the culprit. And now the focus is shifting even for smaller particles, PM1 and even nanoparticles. We do not have very good technology to understand the temporal variation in 2.5 and spatial variation in even finer particles. There are some new technologies coming up which can give you good idea on particle numbers as well as size distribution for different sizes, but they're laser based. So we need to do more research on understanding how do you transfer laser based measurements to more mass based concentrations.
Great, thank you, Anil. I'm afraid that's all we have time for in terms of questions. I'm really sorry if I didn't get to yours. We had a lot of them coming through, but thanks to our attendees that put them in there. That's it from us today. Thank you for logging in. I really hope you found this beneficial and informative. Don't forget to record your attendance at this webinar on the IES CPD tool. This webinar has been recorded and will be made available on the IES website and YouTube channel. The next IAQM webinar will be on the 27th of April, and we'll be looking at the role of local authorities in managing air pollution. Again, this is free to attend, so please do visit the IES website to register. Thank you once again, Anil. That was a really great presentation, and I hope you have a great rest of your day. Thank you, everyone.
Thank you very much. It has been my pleasure to talk to you.
Thank you. Bye.